Good morning. Welcome to the Health and Wellbeing Board for the 4th of June 2020. I'd like to welcome all of our partners to the first virtual meeting of the Health and Wellbeing Board for Bournemouth, Christchurch and Poole Council, and to the press and members of the public who may be viewing us through our live stream of the meeting. I'm going to pass to our Democratic Services officers to set out the housekeeping arrangements for the meeting. Can I just check whether, and we also have a observer who is joining us for the first time, so particularly welcome to Jenny if you are watching us. So Karen, can I pass over to you for housekeeping, please?
Many thanks, Chairman. In relation to the arrangements for the meeting, please note that this meeting of the board is being recorded by the Council for live broadcast and will be published on the Council's website for a minimum of 6 months. In order to ensure the meeting is managed effectively, please could everyone present follow these ground rules for speaking. Only speak when invited to by the Chairman. State your name before you speak if you've not been introduced by name. Some people may need to dial into the meeting and will therefore not have the benefit of the visual. Please mute your microphone when you are not talking. If you would like to speak, please type RTS, request to speak, in the instant message conversation panel on the left-hand side of your screen and click the arrow button to send. Please note that this panel is visible to all parties. If you are able to, it may be helpful to indicate the particular issue you wish to speak about in order to try and maintain the flow of the meeting. If there are any recommendations moved that require a formal vote, these will be carried out by the Chairman, asking for a response of for or against from each member of the board. And finally, before we start our formal business, please can I ask you to ensure that background noise is kept to a minimum as far as possible, and mobile phones and other devices are turned off or switched to the silent setting for the duration of the meeting. Thank you, Chairman.
Thank you very much for that. That's great. Okay, so we are quorate. We are aware that there may be a couple of people who haven't managed to join us yet, but can I just check, do we have any apologies received for the meeting?
Chairman, I can report, as far as I've been notified, that we have apologies from Graham Farrant, Chief Executive of BCP Council, Judith Ramsden, Executive Director, BCP Council, and also from James Vaughan, Chief Constable. In relation to item 2, Chairman, to report the substitutes that we've received notification of, ACC Julie Fielding is here replacing James Vaughan for this meeting, and Julian Radcliffe is replacing Judith Ramsden. As you've indicated, Chairman, we do have an observer, Jenny Douglas-Todd, who's joined the call or hopes to join the call. And in addition, I understand that Debbie Fleming, if she's able to join us, will need to leave at 11 o'clock. Thank you, Chairman.
Thank you very much for that. Okay, that takes us on to agenda item 3, which is declarations of interest. Board members are asked to declare any disclosable pecuniary interest or local interest in respect of the issues before the board today. Can I ask if anybody has any such interest to declare?
Chair?
Yes.
For transparency, I should say that I've started working back at the Royal Bournemouth Hospital during the pandemic, so just to note.
Thank you, Councillor Wilson. That's helpful. Okay, so I'm going to take the previous silence as assurance that nobody else has any disclosable interest to declare. Takes us on to agenda item 4, which is public issues, and there are no public issues for this meeting. We haven't received any questions or petitions or public statements. Agenda item 5 is the confirmation of minutes and the action sheet. Everybody will have had that circulated previously. Are you all content that the minutes are a true representation of the board held on the 30th of January? And are there any comments on the action sheet? Okay, I note that obviously with the cancellation of the previous meeting, some things have had to have been moved, and you'll see them when we get to the forward plan at the end. You'll see some of that referenced. So can I just ask, I don't know whether the CAMS report, the Children's Mental Health report, was due to go to the Children's Overview and Scrutiny Board. It's probably worth noting that I don't believe we've had a Children's Overview and Scrutiny Board during the period of lockdown, so that will have been delayed. We need to make sure that in our forward plan notes that we ensure that that doesn't get missed, so that when we take this paper again later on in the year, that item has been covered. So is there any dissenting from confirming the meetings or noting the action sheet? Okay, in absence of that, agenda item 6 is the response to the COVID-19 from our Health and Wellbeing Board partners. And before we start, I just want to acknowledge that the COVID-19 has led to a number of deaths in the local area, including from organisations that are represented by the Health and Wellbeing Board. I want to acknowledge the loss and the pain of everyone who's been affected by COVID-19, and thank all of the staff across our board partners, including NHS and care sector, police, fire, council and the voluntary sector, who've been supporting the public through the process. So just make sure that that is noted for the minutes. Okay, so what I'm going to do is we have a report that's been presented by each of the members of the board. Apologies, emails coming in. So I'm going to introduce the item with the lead officers for each section. The slides will be taken in turn to enable most agencies to speak. I wanted to check, is Sam Crow with us? So I think the first... Oh.
I'm here now.
Okay, that's great. Okay, so I think everybody who is due to present is actually in the meeting. So if I can hand over, first of all, to Sam, who I think is covering the impact of COVID-19 in the area. Sam.
Thank you very much, Chair. So you bear with me a second. What we've done is we've produced a compilation report for the board today, which takes the board through the impact of COVID for our area, and also really details the perspective of how COVID-19 has affected BCP Council and its residents through the lens of different organisations and the different responses that we've had to stand up. So some summary information about the impact of the pandemic. Obviously, the report deadline was earlier on in May, so the figures that you have in the first slide are very much representing the situation at the time. So 465 confirmed cases in the BCP Council area. That has gone up slightly since the 20th of May, but it does feel that we're at the tail end of that initial pandemic peak, which is good. Sadly, the infections have resulted in a number of deaths, and as the paper shows, at the time this paper was put together, 142 deaths among people admitted to our local hospitals and 120 deaths, sadly, among people who are resident in our care homes. The overall infection rate in the southwest region remained the lowest and still remains the lowest at 131 cases per 100,000 population. And our assessment is that the way the outbreak has affected us in BCP Council is much more in terms of ongoing transmission in clusters associated with some settings like hospitals and care homes, not widespread community transmission as the type that you will have seen in some of the larger urban areas like London, Manchester and the cities in the Midlands. So the next slide shows the command and control structure that's been stood up as a result of the agencies involved in the Local Resilience Forum. This shows all of the different groups and connections, not just within the Dorset Local Resilience Forum, but also looking upwards to the regional groups and also nationally how those groups feed through into the National Incident Response as being led by Department of Health and Social Care, Cabinet Office Briefing Room and MHCLG. Don't propose to go into those in a huge amount of detail, just to say that a lot of members of the Health and Wellbeing Board are also actively represented on the Dorset LRF SCG, which is in the middle of the diagram, slightly to the right. That strategic coordinating group, in my view, has been incredibly effective at actually setting the strategy and making sure that all of our partners are pulling together in terms of the response that we've stood up. And you can see the range of subgroups beneath that at tactical and operational level. And certainly my assessment and what I've heard from independent observers is that that response has been fantastic across the board.
Okay. Thank you, Sam. That's really helpful. And we'll take any questions at the end, if that's okay. So can I then move on to, I think Tim Goodson is going to be introducing the NHS elements of this, and then if appropriate, introducing any of his colleagues on the NHS slides. Is that okay with you, Tim?
Yeah, that's fine.
Okay.
So thank you, Chair. And I'll just echo the previous comments around some of the sad loss of life that we've seen with this, and that has been coupled with some of the fantastic work that's been done across the key workers right across the public sector in Dorset. So if I just concentrate perhaps first on the first slide there, and just give a bit of a flavour of what this has been like. I mean, certainly at the start of the process, that there was very much a focus nationally in terms of the surge that was being foreseen that was going to come along to the NHS, and there was a lot of talk at the start around that, and that led to very much, we need to protect effectively the acute hospitals, particularly some of the critical care beds, and we needed to create capacity within those hospitals for a potential really high peak in terms of the number of patients that could end up within the NHS. So the initial focus there really was around emptying the hospital beds, and there was some really good work done right across the system partners to really focus on that, and it was very successful in terms of creating the capacity that we needed within the acute sector. That also included the stopping of some of the routine sort of elective care, which we're now beginning to sort of switch back on again. But certainly at the start there was really 100% focus on really the emergency and the peak. It wasn't just a case of just empty the beds. There was temporary building work has been done. So if you go into any of the acute hospitals now, you'll see temporary partitions going up. You'll see changes around sort of temporary doors as well, and the flow of people around the actual sites, and trying to keep as much as we can sort of the social distancing within the actual acute setting. There was very much a focus on trying to create as much critical care capacity within Dorset as we could. Normally we only have 31 critical care beds in Dorset, and the whole plan really was how can we actually increase that. And you'll probably recall all the focus on sort of ventilators. Can we actually get enough ventilators to do this? But we came up with a series of plans that increase the capacity in Dorset, and we're currently operating with 51 critical care beds. But as of today, there's only 17 patients within those. But we had other surge plans that would take us up to 115 and 188 critical care beds that we could actually use within Dorset. And in addition to that, there was then a focus on the Nightingale type hospitals to create additional critical care capacity outside of that. Other things that sort of stopped or changed during this, so it wasn't just the elective works and the face-to-face outpatients stopped, all the staff training stopped. There was arrangements put in nationally to put on hold a number of the planning things that were going on, and it really was a focus in terms of, you've got to do everything you can to make sure effectively that the NHS is safe and we can continue to cope under these circumstances. So a lot of the usual business as usual things were all put to one side, and everyone did focus on this. Community hospitals also played a part, similarly discharging a number of their patients, so we could actually stand out from the acutes into the community hospitals, and the continuing healthcare process also was put on hold effectively, and it was a case of let's just find out what people want and meet those needs, and not go through the continuing healthcare process at this point. You may have come across the term hot and cold sites. So that was really the hot site was creation. Okay, if we have got affected COVID patients there, then it became hot, and affected cold sites was trying to keep something COVID free, although there's no real such place as a COVID free site. So we don't know who actually has it, and people can actually have it and not show any signs of it. But that came into play quite considerably, and certainly some of the primary care GP sites have tried to do that. So we try to say, okay, let's take anyone that's coming in with COVID type symptoms in one place, and if it's not related to COVID, then let's keep them in another place. And some of the practices have managed to do that just within the actual practices themselves, and some of them done it in areas across some sort of the branch sites or shared with other practices to do that. Some of the other services have continued, so all practices have remained open during this period. Some of the home visiting community services have still continued, and we've tried to provide as much support as we can to care homes as well, and that's certainly increased during the latter phases of this, as we've had sort of one-on-one sort of training with them and trying to get sort of PPE and any sort of advice to them. So if I move to the sort of the second slide, there was and still is a huge sort of demand for PPE, so personal protective equipment, and that's very much been the focus, just in terms of the sheer quantities that are needed. And even in Dorset, you're talking in the millions in terms of the amount of equipment that's been required, even though our cases are relatively low compared to some places. We've still had to provide all that equipment for the staff to be able to carry out their sort of day-to-day sort of procedure. So that has been a huge ask of the system. It has been really good to see the mutual aid and sharing of this across different places. So we've never reached the point where we've run out. We have got fairly close to the wire on some days, and the trust, particularly in Dorset, have then shared theirs and released it across. So that's been good to see, and that's also been sort of replicated outside of the NHS now through the Local Resilience Forum. Testing requirements again have been good to see the increasing focus on that, and we've sort of moved now from a position of testing just for the COVID, looking now more around, well, who's actually had it and trying to build up that sort of knowledge of it. And we've seen the introduction of the public testing sites over at Creekmore as well, and the mobile sites across Dorset. I'll skip the next two, so I've covered those, but the use of technology, we've effectively tried to get as many people working from home where they can do so. So it's been a real increase and ramp up of that. And similarly, within the actual health settings themselves, if we can do either telephone or video consultations, that's very much become the norm, not only just within the outpatients, but also within primary care. And we've tried to use as well sort of e-consult, so you go through a web-based approach first, and then you can have a telephone or you can have a face-to-face video conference, and that's been similar for the use of 111 as well, trying to push people towards the 111 website, which is kind of a self-diagnostic type sort of tool and facility, or then go on to sort of the phone call type arrangement. And there has been a huge uptake in that, and it's actually proven really popular, just in terms of the sheer numbers, and some of the people that hadn't used it before are now using it. So it's been a real positive in terms of use of technology. If I go on to the next slide. There has been a number of concerns as we've gone through this, and we've seen a really quite a dramatic drop in some of the referrals that we would normally expect to see in the non-sort of COVID areas. So some of the cancer services, children's services, cardiac services, I think there's been a worrying drop in terms of the referrals in those areas. So we've tried to push out the message that the NHS is open, and if you've got any concerns on those areas, you should be contacting the NHS either through the 111, ring your GP up as normal to do that. So that has very much been our sort of media campaign over the last few weeks, because the numbers have been down compared to what we would expect to see, and there's no really good reason for that apart from people are just not making sort of contact coming forward. We did see a prescribing surge at the start of this, So, people that hadn't perhaps used, say, inhalers for a number of years, suddenly felt, I would assume, a bit less secure around what they were doing, and effectively have contacted GPs, and people started to stock up on some of their sort of prescriptions. So we certainly saw a peak in sort of prescribing. That now has sort of settled down again, though. And we're back. I wouldn't say we're totally back to normal levels, but we've seen this peak go up and sort of flatten off again. Mental health, again, it's similar to the reduction that we've seen in some of the other services. So the number of contacts around mental health has gone down, and it's really been a similar sort of message. We are open for business, and we want to see people that need to be seen. So there is a concern there in terms of will there be a knock-on effect of this that will start to come through sort of later as we sort of go through the year, where people have have not coped so well with this. If I move to the next slide, so what we're now seeing is a bit of it's been described as phase 2. So there's 4 phases the NHS has described this as, and we've now moved into phase 2, which has been to try to switch back on some of the sort of the routine sort of diagnostic work, trying to get the elective work up and going again, using the private sector to do that, and keep effectively some of the stuff off the main acute sites. And you're probably aware the NHS sort of took over the private sector on a national sort of basis, and we've been making use of that in Dorset as well. And try to use the technology as much as we can to keep things going, and try now to start to step up some of the routine sort of elective appointments to do that. Also around some of the primary care networks, and these are very new. They sort of came in this year. This is the group of the GPs sort of coming together, GP practices across areas. They've worked really well together actually in terms of supporting practices, both in terms of sort of staff and again sort of equipment, and creating sort of hot and cold sites. And we're very keen, and they are very keen to sort of keep that sort of relationships going. If I move on to the next slide. So we've tried, as we've gone through this, to try and keep the public as engaged as much as we can, and there's been real big pushes out across sort of social media in particular, and sort of letters through sort of the Echo and thing, just trying to make the public aware, as I said earlier, that the NHS has been open to business in doing this. We've tried to use some of the community groups as much as we can, and keep those sort of feeders going out so everyone's aware of that. And we want to try and keep going with the sort of public going forward. And if there are any changes that we think, well, actually, this is going to be something that we want to keep going, then really the normal statutory duties apply in that around sort of engagement and sort of scrutiny committees to sort of do that. But at the moment, we're still very much in, this is sort of an emergency sort of dealing with it. It's still sort of major incident across Dorset and the country. But we are now starting to look much more on the recovery planning, getting sort of business back to normal. If I pause there and perhaps ask if any of the other NHS colleagues on the line wish to add to that.
Hi everyone, it's Debbie here. I don't know if it's helpful. Tim's given a very comprehensive and very thorough update around the NHS position. If I was just going to add a couple of comments, it's just to reiterate, obviously, how much better everything is at the moment compared to how it was. The numbers at the moment across both my trusts at the moment, I've only got 6 patients in with COVID, which is quite incredible, and 1 in intensive care, which is so amazing. So thank goodness for that. I think I've just got a couple of key messages. One is we cannot underestimate how hugely disruptive this has been within our existing services. Secondly, I think we've done extremely well. I'm really proud of both trusts. I'm also proud of partners across the BCP area. I think we've worked really well together, and I'm really proud of the partners across the wider Dorset. So I think we have done exceptionally well. As Tim's indicated, there's been masses of transformation. And I went to Christchurch Hospital yesterday, and I have to say, just talking to staff there about what COVID has meant for them and their services, it's been really, it is humbling and it is exciting. And we know that there is so much transformation that we absolutely want to hold on to, and that's an echo across many services as far as I know. Just want to reiterate, I think it's going to be a very long time before we see anything looking like normal within our acute sector. There's such a lot of complexity to be managed. It's a bit like the lockdown. It was easier getting it locked down than it is to set it back up again. And for us to do that safely, to be bringing people into this environment safely, is very challenging. And also, the patients and the public are so frightened. Lots of people. It doesn't always show when some parts of the population are leaping off Durdle door, but actually my experience talking to our elderly patients and many people hugely frightened. And I think just to flag that from my point of view now, one of the big issues that I'm grappling with are my responsibilities as an employer, and making sure in the same way as any other employer that we are taking all the steps we need in providing services, looking after our people. And top of my list at the moment is the black and ethnic minority background individuals who are at particular risk. So that's just a little bit more flavour of what the world is like for me at the moment. Happy to take any questions.
Tim, I'm online. I think Debbie and you have covered everything that I would want to raise, so nothing to add.
Okay, that was Eugene from the Dorset Healthcare Trust. Okay, so can I just ask all members when they speak if they could just clarify who they are, or the organisation they represent, because the public watching this aren't always going to be aware. That would be really, really helpful. I'm going to just hold off on questions at the moment, if that's okay. I just need to clarify, we had somebody on the call who's calling from a mobile number. Would you just be able to say who it is for the record, because we don't have your name attached to it? Is that you, Eugene?
That would be me. Thank you.
It would be you. Okay. So for the record, Eugene Yefeli from the Dorset University Healthcare Trust. Okay. I do have a request to speak from Leslie. Leslie, are you okay if I hold on and just go through the presentation and take questions at the end?
Yes, that's no problem. No problem.
Okay, I just think that would be more useful. I'm also conscious that Debbie has to leave at 11 o'clock, so I want to make sure we can complete this item and deal with all questions at that point, if that's okay. So can I just pass then on to Julian Radcliffe, who's going to present something about the children's services. And for people who might be watching this, these slides are in the agenda pack. So if you go to the website with the agenda, scroll down, you will see all of these slides available for you to have a look at. So Julian, I've passed to you. Thanks.
So thank you, Chair. It's interesting reflecting back on how things were in mid-March, actually, when lockdown started, and so much has happened since then. But in terms of children's services, the initial challenge we had, when the announcement was made in relation to schools closing, there were two, to be fair. Our initial concern was what's the impact on some of those vulnerable children in our wider communities, and in addition, how are we going to fulfil our responsibilities to make sure that there's sufficient capacity in both our schools and early years to respond to the need to have key workers, being able to have children in school safely and deliver the services that we required across BCP. So our first challenge was to set up a brokerage system so that actually our schools, who were in a fair degree of disarray following the announcement that they were closing, were able to mobilise themselves effectively to make sure we had sufficient capacity both in our schools and both in our earlier systems, that we could actually fulfil our responsibilities in that respect. However, you probably won't be surprised to hear that in addition to that, there's a phrase that's often used, which is that schools, settings and providers, how we choose to describe them, are often seen as the ears and eyes of the safeguarding system. When there are children who are presenting with risks and have vulnerabilities, schools do have good oversight on some really vulnerable children across our communities. And of course, at that time, there were a number of children who were known to be vulnerable, actually, who weren't attending school, notwithstanding some of the guidance and expectations that possibly should have. So as a children's services, our priority was to make sure that we had the highest intelligence and best intelligence in relation to those children and young people. We knew exactly who they were, where they were, who was attending school, who was not attending school, and that those children were wholly appropriately and responsibly cited to make sure that actually they were safe, being well cared for. And we spent very significant amounts of time and endeavours working to that and making sure we had the highest intelligence in relation to that aspect. So we could be reassured around our safeguarding and child protection responsibilities, and in line with the guidance that had been pushed out very certainly by the Department for Education. In addition to that, and alongside that, because while we had expectations that the children were in school and they had to be safeguarded, there were real significant challenges across the children's workforce in terms of the overall resilience, whether it's school staff or whether it's the services who have more direct safeguarding and child protection responsibilities. So we spent very considerable amounts of effort and endeavours trying to make sure we understood our own resilience, and wherever we needed to, we were recycling and redeploying staff into priority roles, which from our perspective is making sure that children are sighted and they are safeguarded in line with our multi-agency procedures in that respect. And much of that time was spent as well mobilising our schools who work inevitably with a degree of autonomy into cohesive systems who are working to shared endeavours in this respect, and really prioritising vulnerability by getting children into school settings and or where they're not, making sure that they are cited as often as possible so we can be reassured around their safeguarding circumstances. And to that effect, the local authority made the decision to reduce a number of resources out into the communities, so that where there were children not attending school, we identified new posts actually quite quickly, link worker posts, who were linked into every single school across BCP and externally actually to support schools in making sure that those children not attending schools who were vulnerable and known to be vulnerable were cited on at least 2 occasions every week, and to make sure their needs were understood and their needs were provided for. Alongside that, we are aware that the circumstances in which many parents and carers of children who are vulnerable as defined by the guidance we were working to, whether it's children with allocated social work or children potentially with EHCPs, education, health and care plans, or children known to be vulnerable in other respects, probably children and young carers. We've worked for our very best endeavours to make sure that we had up-to-date information, advice and guidance on any communication system that was open to our disposal, and we pushed out as much communication as possible, because the current circumstances for vulnerable children, particularly and their parents, was a particularly uncertain one, and so keeping people informed has been a real priority to us. I'm very sympathetic to some of the comments of my colleagues previously around emerging concerns around mental health and well-being. There's a lot of talk about it, but it's hard to understand about the impact the current circumstances are having on children and young people. So we've been very proactive in trying to elicit the views of our children and young people, whether they're in school or not. And we put out a survey seeking views in this respect, and we had 3,500 children and young people respond, indicating their views in relation to social connection, emotional health and well-being and related issues, which we only just had back, and we're using that to shape and support our strategic and operational response to supporting children in particular as they return into school, and making sure schools are equipped as they can be to respond to some of the needs the children will present with when they return to school. In terms of some of our statutory responsibilities in relation to education, healthcare plans and SEND and related, the government provided the opportunity for local authorities to work to their reasonable endeavours in relation to statutory processes linked to special needs. This means that there was some easing of the statutory responsibilities in that respect. That's the extent to which statutory plans are written, reviewed, and your reviews are undertaken to make sure children's needs are fully understood and provided for. This is challenging in that parents and carers rightly have expectations about how we provide in line with our statutory processes, and it's been hard to deliver on those. So the local authority has taken advantage of the reasonable endeavours situation that's being offered to us. It has meant there has been delays in progressing EHCPs and in undertaking annual reviews and reaching some really critical decisions. And we have published our reasonable endeavours guidelines and made them very evident through our local offer website and to parent and carers. But I'm very aware that it has created some frustrations within the system for parents and carers who would rightly wish that these things could happen with much greater pace than we've been able to provide at the moment, due to some of the challenges, in particular linked to staffing, in delivering on our statutory responsibilities. But we have tried hard to communicate our reasonable endeavours wherever we can. We tried to innovate as well in terms of our ability to provide the right information, advice and guidance and to parents and carers who we know are working with some challenging children, sometimes in the family homes, and they do struggle on a day-to-day basis. We set up consultation lines where parents can quite routinely phone in and seek support, in particular from our psychology service, and it's been taken up with so much enthusiasm. It's probably our most competed for phone number, and has been really valued by the parents. We've had some really excellent feedback from the parent carer forums in relation to that approach, and I thank the Educational Psychology Service for that, but also for the range of e-resources that have been pushed out into the school system to support remote learning, to support remote approaches to mental health and wellbeing, but also directly into parent and carers themselves, who are experiencing some challenges in providing everything they need for their children at this time. In terms of some of our next steps, we probably have we have a number of challenges like many parts of the system, but in particular I'd make reference to school attendance in the round. So there's an expectation that schools open in different ways this week, and I can confirm that 91, and in particular in relation to primary schools, which is a staged approach to getting children back into school. From this week, my understanding is that 91% of our primary schools are open in line with government guidance. There are real challenges in relation to achieving that, almost uniquely not linked to schools' willingness and appetite to do it, but linked to staff capacity to deliver in line with the expectations of getting the right year groups in school. But we're working really closely with schools, and I would just kind of like to acknowledge how hard schools are working to deliver on this in really quite difficult circumstances. They've done extremely well, and we should be very proud of them as a system, actually. And that will be a phased and ongoing position that we will support schools with over the coming weeks as numbers of children returning to school increase, and we'll keep a really close eye on that, obviously. The second issue which we are working with partners on with schools is understanding how we can ensure that our most vulnerable children who have interacting and complex needs requiring education, health and care plans, who possibly for a number of reasons may not be able to attend school in the short, medium or possibly long term due to the nature of their needs and due to the ongoing potential uncertainty of the impact of COVID-19, is how we can stand up really tall as a local authority and say that we are able to continue to provide their education and health needs, notwithstanding that they're currently in home, because that should not be a barrier to them accessing everything that they're entitled to. Obviously, that is a really complex question to understand and a really complex solution to find, but we are working to deliver on that as the situation unravels. The full extent of the number of very vulnerable children not attending school with the HCPs will be better understood, I believe, from next Monday. I've been in contact with all the special school head teachers this morning, to try and gauge what level of take-up we're having in our special schools, in particular with these children, and it's actually very positive. But there is clearly a number of children, particularly those shielding, who will be out of school some time, and it's our collective responsibility to understand and respond to that, and to organise our services individually around that as well. Chair, I'll probably stop there for the moment, but I'm happy to take any questions subsequently.
Thank you, Julia. That's a really great coverage. The next one that we're due to go on to is Jan with adult social care, Jan Thurgood. Can I just reference the fact that some of the items on here are going to be covered in full papers later on, conscious of time, Jan. I don't know if you just want to briefly cover the areas that are perhaps not.
Thank you, Chairman. So just to say, I just wanted to say Tim has already talked about the work, which was collective work, in order to ensure that our hospitals had the capacity to provide care for both patients with COVID-19 and other patients who need critical hospital care, and adult social care was a part of that. As you said, Chairman, I will talk about the Care Act easements when we get to that item. Just want to talk about how we have had to change the whole way that we deliver adult social care, given social distancing and the vulnerability and the health vulnerabilities of the client group that we work with. So that has meant we've had to switch our work to a lot of telephone and video call support work for people, and in many ways that's been very successful. But we also recognise there are times where people need face-to-face contact and assessment and face-to-face support. In terms of the level of contacts with social care, that's remained at the same level, but with a greater emphasis on people who've experienced economic hardship, who might need help with debts and also with food. And so that's been a greater emphasis in terms of the contacts received through COVID-19. And in terms of adult safeguarding, we have seen an increase in referrals, and that's been in relation to concerns from people who are having to self-isolate and be at home. There have been issues related to people's self-neglect, which have been addressed, but also really importantly has been the issue of supporting carers through this period and the stress that some carers have been under when their normal range of support services aren't available. And we've really adapted our services to try and support carers in a new way, with some success, using group video contacts, which carers have really appreciated. But I think that's an area of real focus and concern for us as the situation goes on in terms of how we support carers in our community. We've done a lot of work with the adult social care provider sector, and we are going to talk later on about the support to care homes. But I also wanted to emphasise at this point that the support has also been support to domiciliary care and supported living carers services as an important section, and to say that we have had very active and engaged dialogue with adult social care sector leaders, with both councils and with health colleagues, and we've found it very important that we support the whole sector through this period. Thank you, Chairman. Happy to take any questions at the end.
Thank you, Jan. So the next part of the presentation is based on housing and homelessness. I'm going to pass to Kate Ryan, the Director for the Environment for BCP Council. Kate, are you with us?
Yes, thanks, Chair. Hello. I won't repeat everything that's in the two slides around the housing response. Just wanted to pull out a couple of details. So to confirm in terms of the numbers, what we were asked to do as soon as the pandemic in effect became an issue locally was to work with our partners to make sure that no one was outside. So there was a real great multi-agency response to ensure that anybody who's sleeping rough or potentially facing homelessness has had a placement, and so that's what resulted in having 193 COVID-related placements, and then an additional 100 placements into B&B that came out of, in effect, sofa surfers, etc., people not able to stay in their current accommodation because of the issues around the pandemic. And we have, despite numerous outreach attempts, still got 15 to 20 people who have remained outside that we've been working with on a continuous basis. I just wanted to run through. In effect, it's provided a real opportunity to work with rough sleepers in a very focused way, and we've done a needs and risk assessment for every rough sleeper through a resettlement worker, and 70% were identified as not having a registered GP. So from a health perspective, we've been able to fast track registration, and we've had a GP and a homelessness nurse visiting every resident in bed and breakfast doing health checks, and that's enabled some really positive outcomes. So referrals to other services, so also mental health outreach and drug and alcohol support. We've had real positive improvements in mental health, in well-being, including better nutrition, eating, long-term issues such as abscesses, etc., sort of having the opportunity to heal, and increased take-up of methadone prescriptions. So in effect, a more stable context enabling services to reach that population. So the challenge really going forwards, beyond what's included in the slides, is to work through the homelessness reduction partnership and with partners and with MHCLG to develop a plan for the move on for this population that looks at addressing both housing needs and wider support needs. because we do have a range of cases from the most complex through to people who actually, for example, with a rent deposit may be able to move into the private rented sector. So that's a focus at the moment, is trying to make sure that we learn the lessons, that we use this opportunity to really see those improved outcomes for this population, and then going forwards that actually through the recovery process we can think through what's really worked well and make sure that we try and keep that going forwards.
Thank you, Kate. That's really helpful. Again, if anyone has any questions, we'll go through them at the end. Don't forget to put RTS in the sidebar so I know to get everyone in the right order. The next part of the presentation is from the police. So that, I think, Julie Fielding, I think, are you expecting to give us a little bit of an update on the impact on crime and disorder for this part of Dorset?
Yes, thank you, Chair. Thank you, colleagues. So, Julie Fielding, Dorset Police. I'm also the Chair of the Community Safety Partnership and chairing my first meeting tomorrow. So, a brief update then around that activity. So, we have the weekly Partnership Coordinating Group and fortnightly Community Safety Partnership Board, and we've temporarily amended the emphasis through those meetings on COVID-19 and the impact of COVID-19. So, what we saw at the start of lockdown was a reduction in crime and incidents, as we might expect, but that has started to level off, and I'm sure colleagues will be aware of the news and the press over the last week or so in particular around the increases that we're starting to see. And some of those increases then are in antisocial behaviour, some around COVID restrictions, but not all. So increasing neighbourhood disputes and reports of drug dealing. And a significant issue for us, of course, is domestic abuse. And we're starting to see increased reporting. So just over the last month, we've had an increase in 6.7% of incidents, and then of crimes, and then 18% of incidents. So some of these are low-level family disputes attributable to lockdown and people being in confined spaces, and adolescent to parent abuse. But there hasn't actually been an increase in the high and medium risk cases. So the increases primarily are in those lower risk cases. So our MARAC meetings are continuing to function well and provide us with good insight and good risk and safety management. And we have a specific response to domestic abuse, a specific DA response plan, which centres around providing safe and secure accommodation, bringing offenders to justice, safeguarding victims, children and vulnerable adults, and providing early intervention and support to prevent harm. And I have seen the detailed updates that have been done in that regard, so thank you to partners for pulling together at short notice that additional delivery plan to tackle domestic abuse during lockdown and during COVID, and I can confirm that good progress has been made. So the next Community Safety Partnership is tomorrow. We have a full agenda including domestic abuse as an update, that's the end of my update for now, Chair. Thank you.
Thank you. That's really, really helpful. I just wondered whether Seth Y from the fire service, we don't actually have we don't have a report from them, but I didn't know whether Seth wanted to add anything from the fire service perspective about the impact of COVID before we move on to the next bit of the slide.
Thank you, Chair. So from us, we've been, I think, quite fortunate. We've had very low levels of sickness across the service. We've been doing a lot of our business continuity arrangements to make sure that our core services were still to be delivered, and we're pleased to say that that has been the case. All of the board will be aware of the recent Wareham fire, and that has put a huge strain on the service in terms of the amount of resources we had there, and we thank our partners for working with us around that. More recently, there's been a surge in disposable barbecues. I understand we've had around 50 fires that we've put out, despite the numerous requests and education materials on our social media websites, in press, both radio and in the newspapers. We've been doing lots of promotions to ask people not to start barbecues or start campfires in areas of dry woodland, but that happens not to have been followed in many cases, and we've had roving patrols with fire engines out there, our Land Rovers out there putting out many discarded barbecues. Now these have been left on the side of the verge or they've been dumped into bins, and I'd be really happy to work with our partners on how we can better get that message across. From personal sort of perspective, I get the feeling that possibly our local population will be aware of the dangers, but the people that may be using the disposable barbecues sometimes may be travelling into the area, so we've got probably a wider issue to pick up there. We are continuing to deliver our sort of safe and well, albeit in a different way, and triaging through our safe and well team. So from the fire service, we've got one eye on, as everyone else is, sort of returning to normality, but working our way through the complications that brings. Thank you, Chair.
Thank you, Seth. That's really helpful. The next part of the presentation, we're back to Sam Crowe, the Director of Public Health, about impact on wellbeing. I know we've got quite a lot of detail there. Sam, do you want to just quickly take us through the highlights on that?
Thank you very much, Chair. So I will keep it brief because of time. For board members' information, I've also put into the sidebar a hyperlink to a new Public Health England review, which picks up on some of the factors that I've highlighted in this slide around the differential impact of COVID-19. So as the slide shows, it has had disproportionate impacts in some groups, more likely to affect males than females, and the fatality rate clearly rises with age. Unfortunately, death rates are twice as high in people living in deprived areas compared with least deprived areas. And as I said in the opening slide, the urban areas have had the highest death rates and the highest numbers of cases. There's an ongoing concern about the impact of COVID in black and minority ethnic groups. That's covered in part by the PHE review. And we're still, I think, waiting to assess the true impact of the indirect impacts on inequality from the economic impact. Early information from some of the reviews of the impact on the economy from the Office of National Statistics show that people working in the accommodation and food services, unsurprisingly, are going to be the most affected. Just a couple of comments on mental health from me, really. The ONS regularly surveys national measures of wellbeing, and they regularly ask people how anxious they're feeling, and this has picked up very, very clearly that in March there was a huge spike in the number of people reporting feeling anxious, unsurprisingly, so that had jumped to 21%, and underlying that were concerns about people's own economic circumstances and their tenure status. Physical health, just a couple of local issues. We've seen more people accessing support from Live Well Dorset, particularly for smoking cessation. Links between obviously lung health and the impact and the severity of the disease. That's driven quite a few people to seek support from our services, which is really good news. And surprisingly, the Sport England surveys have found that fewer people overall are exercising regularly, which was a surprise to me when I looked through their surveys, because it's easy to be, I guess, fooled into thinking that when you look outside, there do appear to be many, many more people who've been exercising through lockdown. But this is because of the split between people who were already regularly exercising, who've exercised a lot more, and perhaps people who weren't regularly exercising, who have exercised a lot less during lockdown. And my final favourite fact, more people apparently in the UK believe that we will be more united and kinder after the outbreak than before.
Sam, I hope you're right. I really do. Okay, that's really helpful. Thank you. So that brings us on the final section of this report is around the impact on the voluntary sector. I'm conscious, Karen Loftus from the Community Action Network is that there's quite a lot of overlap with the next paper on the response around community engagement. So I just wonder if you want to just cover the areas that don't do that and then work with Kelly on the next piece. Would that be okay?
Yes, that's fine.
Crack on. You got anything to add that doesn't relate to the community engagement piece, the wider voluntary sector?
Okay, is Kelly here or is she?
Yeah, Kelly is here, but I'm just conscious the next item on the agenda is specifically about what we've done around the community hub, etc. So I don't know. So that's got a separate paper. I'm just wondering the impact on the voluntary sector outside of that direct response.
Yes, absolutely.
Is there anything you want to cover specifically on that, and then we'll cover the other parts on the second paper if that works for you?
Yes, of course. I mean, the wider voluntary sector, I mean, has demonstrated, there's been a huge response across the community and across the voluntary sector. My organisation, Community Action Network, we're conducting a phone state of the sector piece of work at the moment. We've already spoken to about 50 local organisations, and I can share some initial findings with how that's going. We've also been able to direct people to the Dorset Community Foundation, and they've distributed hundreds of thousands of pounds across Dorset to different charities. Just an example, SEDCAT, who's the South East Dorset Transport charity, they've used some money to convert one of their minibuses to enable them to now safely transport people to and from hospital, which they wouldn't have been able to do without that support. Lots of organisations and groups across the sector have adapted. Communities have, by and large, in our view, responded what works best for their community. And like lots of us, communities are rapidly learning about different ways of communicating. We know that Poole men's sheds, for example, have now got a WhatsApp group. Our uniformed organisations are Zooming. Citizens Advice are holding web chats. Prama have got phone-in friendship lines. Age UK are adapting all their services to be online or phone supports, and Crumbs are using online and training people online. So there's a lot of work that's going on there. In terms of volunteering, we've seen a huge surge in volunteering, and I just wanted to say that from the realisation between council colleagues and my organisation that we needed a lot of volunteers and fast to support the Together We Can resilience work, to our first volunteer coming forward was 24 hours, and now we've had over 2,500 people coming forward. Part of that was working with voluntary sector and also working with Royal Bournemouth Hospital, who very kindly gave me 200 of their experienced volunteers, as they weren't at that moment able to safely deploy them. So it was a real joined up working together approach. There's been some great collaboration across the section too. For instance, in Boscombe, the Grounded Community and Boscombe Community Fridge are working together on a new project called Feed Our Community. And in Christchurch, the Community Partnership are working with lots of smaller organisations, and they're banded together to deliver hot food, and they're also carrying out check-in phone calls, which has been amazing, really. In terms of capacity ongoing, our initial findings with the groups that we're talking to at the moment is that the majority, this is a huge concern for a majority of groups, and as Community Action Network, we're looking to how we can harness the goodwill and create flexible volunteering opportunities going forward. Lots of organisations have been very quiet, but some have used the downtime to actually plan for the future. So places like Bearwood Community Centre have given their centre a facelift during that time. In terms of future viability, lots of organisations are telling us, most of them actually, are telling us this is a huge concern. Over a quarter of organisations that we've spoken to have furloughed staff, and they're all concerned about their long-term sustainability of their work and how they can get back to normal, whatever normal is. A lot of our charities rely on retail income, which has basically stopped. So also most of our organisations have continue to adapt. There's been some fantastic and innovative work going on, and they're going to have to continue to adapt and be flexible going forward, and they know that, and my organisation stands ready. And lastly, I think Kelly and I wanted to put a question out, is how do we ensure we don't just rely on the sector in a time of crisis, but actually we include that in our new normal? How does that look in our new normal? What does that look like going forward? And happy to take questions at the end.
Thanks, Karen. I'm just going to bring in Louise very briefly from Health Watch, just to cover that side of it. I'm just conscious we've been on this for an hour, so we need to try and wrap this up fairly quickly. So Louise, do you want to just add a few things?
Thanks, Vicky. I'll be brief. So at Healthwatch, obviously the team are all working from home, but that's been working really well. We've set up an online survey to gather people's feedback about the health and care issues that they're facing during this virus outbreak. We've had just over 50 responses to that so far, with really detailed kind of feedback from people about what they're going through. The main issues people have been raising with us are around access to GP services, access to pharmacy and medication that they need, mental health, as has been mentioned earlier, and now we're starting to see feedback about hospital services over the last couple of weeks. I guess where things are changing, services are adapting now. We've got quite a few promotions going on at the moment. Jan mentioned carers earlier, and we're doing quite a bit of promotion next week for Carers Week, sharing people's stories about what they're going through at the moment in order to encourage people to come forward and share their feedback with us. We've been doing quite a big promotion this week around volunteering, and for Mental Health Awareness Week a couple of weeks ago, just trying to share resources, work with the voluntary sector and with the councils and the NHS to make sure that we're getting those messages out there to people. I think that we're also working with Karen quite closely at the moment. Karen mentioned she's been contacting the voluntary sector organisations to get their feedback, and one of my members of staff is helping out with that. So yeah, working really closely, collaboratively, and just trying to help get those messages out there. Thank you.
Thank you, Louise. That's great. So I'm just going to round it back up with Jan. I think you're just going to pull this together around recovery and reset, and just a thought around our annual theme. So can I just bring you in to finish this up, and then we will take a few questions if people have them.
Thank you very much, Leader. In terms of recovery and reset, as we've talked through the presentation, people have talked about beginning to think about recovery, but also it's a mixture, because we're in some positions we're still responding to the incident. So we all know that recovery and reset will be quite a long journey, and people have also talked about great new collaboration through the period, and also positive innovations that we want to learn from and embed. So all partners individually are beginning to think about that, as well as in partnerships, both through the local resilience forum, but in other partnerships such as this one, and indeed the Community Safety Partnership. Prior to March, the Health and Wellbeing Board had agreed an outline health and wellbeing strategy, and we were looking to bring that forward. The suggestion is that we will bring that health and wellbeing strategy forward to our next meeting, whether that's in July and August, and we'll be discussing that in the forward plan section. And then in terms of an annual theme, we were committed to having an annual theme where we really promoted an aspect of wellbeing and health in terms of all our local people. And our theme this year was physical activity. So I think the interesting question is, should it remain physical activity? It's interesting in the light of what Sam said about reduced physical activity, or do we want to consider something else? So I think we wanted to get to invite the board's views on that, and that could be both in terms of people responding verbally, but also we have got the ability for people to put comments on the chat bar on that. Thank you, Chairman.
Thank you for that, Jan. So I've got two requests to speak at the moment. I am just conscious that we've covered an awful lot. There's a lot of information there that's been shared. First of all, I just want to go to Jenny. You're not a member of the board or an observer, but you've made some comments about the ICS. I don't know if you just want to just throw those into the mix. Would that be useful? Just very briefly.
Yes, happy to, Vicky. Just very briefly, I'm the independent chair for the ICS. I started in post in Dorset on the 2nd of March. So my period here has been basically through the COVID-19 response. And one of the things that I was keen for us to do, and some of that's been mentioned as various people have contributed, was for us to capture the lessons around how we were working and making decisions during the response, so that we could take those forward in the recovery and reset. Clearly, during the C19, we all had the same focus. The recovery and reset, as I think Debbie already mentioned, is going to be more challenging. Because in addition to trying to get things back to normal, we've got the infection prevention control that needs to happen and social distancing, as well as budgeting concerns. So those are things that we are trying to apply the learning that's been captured across the system, and also thinking through as an ICS what the future looks like and how we can maximise the way that we work as a system for the benefits of the Dorset population.
Thanks for that. Okay, so we've got Leslie Debman, you are next.
Oh, thank you, Leader. Yes, Councillor Dedman from Adult Social Care and Health. Can I say, first of all, I'm really proud of having heard all this and obviously read it all, really proud of everything that's been done. It's been a terrible time and we've all been touched by it. I'm really sorry for those who have been really affected. We've lost 2 extended family members, so I know how that feels. The main question, and I think it was either to Tim or to Sam, I'm not sure, and even if they're not here, but we know that we've got the overall infection rate, the lowest is in the southwest, and I'm just wondering how that could be explained. Is there an explanation, or will it be something that we learn later on when we've done all the tests and the judgments about what we did and how we did it? Is it something we did, or was it just chance? So I don't know if either Sam or Tim can answer that.
Sam or Tim?
I think that's probably one for Sam, if I was honest.
I agree.
Thank you, Chair. Thank you, Councillor Dedman, and thank you, Tim. I think it's just because we lack those real urban centres, and particularly the importance of transport hubs, I think will really come out in the look back as to how this country got itself into, quite a serious situation without, I think nationally we underestimated just how much COVID there was in the country at the early stages, and that's coming through very clearly now. So we are sort of fortunate in our geography and the way that our populations are relatively dispersed, notwithstanding BCP is an urban area. But of course the flip side of that is that we've got a lot of people in the population that are still susceptible. So the prevalence of people who've been exposed to COVID remains lower here in this part of the world compared with other urban areas. And that's something we need an eye on going forwards as we start to think about planning for any local outbreaks and potential surges. Thank you.
Yes, that's what I was going to add as well, that if there's a surge, well, we are in a good position, aren't we? So thanks very much, Sam.
Okay, thank you. Sandra, Chair of Children's.
Yeah, thank you, Leader. Actually, my question is probably related, so it's probably Sam that's going to need to answer this. But I have heard that the R figure has increased locally. Can you confirm that's correct? Because obviously there is a concern for me in particular that the children have started back to school this week. So, should we all be concerned? And is the R being carefully monitored locally, and all the information about it is being shared with children's services, just so that we can act should we need to? Thank you.
Can I just add on that I have had, references from parents and schools about their concern about if it's going up, whether actually the advice to schools remains the same, with one school who's delayed opening as a direct result of the worry.
Thank you very much, Councillor Moore. It's a complicated question, and we've sought advice from this from Public Health England, because there are people that are publishing estimates of R from various different sources. We don't believe that estimating R at the level of a population of a size of a council like BCP Council is very reliable, and instead we rely on the regional estimates, which is published, and that's shared with the regional SCG group on a regular basis. I believe the R level for the southwest at the moment is around 0.9, so it's close to 1. But obviously it is an important question. So if I move now to what we're doing locally to try to provide local assurance, what I receive every day is an estimate of our local case rate compared with other councils in the southwest. and we can tell quite quickly how many cases are being notified over the past 5 days, which gives an early indication as to whether we start to see that rise or not. If it starts to rise, and if we think it's out of kilter with what we would expect for our local area, then obviously that would be a concern, and we would start to have discussions with all agencies locally about what the implications of that might be. Later in the meeting, we're going to talk about local outbreak plans, and that will pick up that point in more detail. So I'm assured at the moment that our risk is low. You can also have a high R rate and a low number of local cases, and that's just a function of the way that the maths works. So I am told.
Thanks, Sam. Kieran, Councillor Wilson, you had a question.
It wasn't so much a question as just a comment around housing. I want to first just say very briefly how well we've worked with our health partners, and it's great to see such positive outcomes, you know, and I think this is a real opportunity to improve outcomes for the most disadvantaged people that we see and we deal with. But I wanted to make a wider point about housing more generally. You know, this pandemic and being in lockdown has shown how important decent homes are, you know, in our communities and in terms of our well-being side of things, and being able to kind of have a good quality home where you can work from, or you can you know, like the value of a garden. I've never appreciated my garden so much, kind of thing. And I think these are simple things that when we were pre-COVID, we weren't really we were taking for granted, but now as we have to spend so much time at home, we're seeing the importance of them. So I think in the recovery and everything we do from now on, I think we really have to put an emphasis on good quality housing.
Thank you for that. Okay, so I haven't had any more requests to speak about this. I have had quite a lot of comments coming through about the focus actually changing to mental health and well-being, which feels like a consistent message that's coming through, which of course we all know that physical activity improves your mental health, and so there is still a remaining link. But I think we probably need to take from the conversation on the side that the strategy change towards the mental health and well-being following COVID is probably the appropriate way forward. Can I just hear from anyone who feels differently about that, factoring in the element of physical activity within that? Okay, I'm not hearing any dissent on that. I've got no further comments about. So I think if we take that forward so that we can put some thought around that. Is there anything further to add on this paper, or are we happy to note the position, which is the call from this paper? Okay, I'm going to take that as noted. I'm going to thank everybody for their contributions on that. There's such a lot of work going on, and we've only really just scratched the surface of the amazing things that have been going on. And the impact that this can have on you know, I'd like to think that online GPs will become the norm for many people. I certainly hope it will. And some of the work around children's, the innovative stuff that's going on across the whole sector, I think we need to learn from and capture those things, and not only make the world kinder, but actually you know, more agile with what's going on. So that takes us finally on to agenda item 7, which is the community response to COVID-19. So Kelly Ansell, the Bournemouth, Christchurch and Poole Director of Communities, is going to present this report, which Karen Loftus to support with. We have covered a lot of it, so I'm going to try and move sort of through it with just picking out the salient points around what's been going on with that. So Kelly, can I pass over to you, please?
Thank you, Chair. I will just be very brief. So the report summarises all of the community response activity across Bournemouth, Christchurch and Poole, and that's set across 3 things, with Operation Shield, the Together We Can programme, and of course the voluntary and community sector response overall. So with Operation Shield, people will be aware is the national programme which is supporting the most clinically vulnerable as a result of COVID-19. And our arrangements locally have continued to support this programme. by early next week, we will have made telephone contact with every shielding resident across BCP to make sure that there has been an assessment of their welfare and their support needs. And alongside that, we're also conducting welfare visits for people who we haven't been able to make telephone contact with. And in the last 3 weeks, 418 of those visits have taken place. I'm pleased to report that we're not seeing any significant issues in terms of those people we've previously been unable to make contact with. At the moment, we're waiting to hear from the government around the future of shielding. We're waiting for guidance from MHCLG on the directive that I mentioned in the report, which asks us to make proactive contact and share outcomes directly back to the government. The future of shielding obviously remains to be seen. We're waiting for the review on the 15th of June and obviously waiting to hear what that will mean for those shielding residents and also for us as a local authority in terms of the expectations around what support we'll provide. It's fair to say that it's anticipated that shielding will be extended, and as a result we need to obviously think about how we sustain that position across the area. Moving then to Together We Can. This is the programme that we set up locally, working with public sector agencies and the voluntary and community sector partners so that we could collaboratively work together and support our vulnerable and isolated residents, not just those who are shielding, but those people who fall outside of that scope. So detail in the report, it's fair to say, is just a snapshot, a very limited snapshot actually, of what this partnership has achieved over the last 3 months. So much has been developed at pace, all targeted towards supporting those vulnerable and isolated residents. There's been real passion and commitment from everybody that's been involved, and the pace of delivery continues to be significant. So reflecting on that, I just wanted to just mention a couple of changes to the numbers in the report. So we've now received 12,500 calls to our helpline. 3,600 people have been provided with detailed advice, support or direct assistance. And we're currently sustaining, as Karen mentioned, over 2,500 people in our volunteer hub. 1,600 of them have been deployed to support vulnerable people directly. And it's interesting to note that actually the vast majority of the people who have needed direct assistance have not been within the shielding group. It's been our older population and our people who are vulnerable and isolated and don't have the support of friends or family or their local community. Positively though, the numbers, given that by the end of next week we will have contacted over 16,000 people proactively, actually the number of people who directly need our support is quite low. We've actually only, with 1,600 people directly deployed to support those people with help with food or shopping or prescriptions and other essentials, it has been heartening to see how many people are receiving just a response from within their community. We talked about kindness earlier, and the goodwill and the good neighbourly activity that's happening has really helped. So there is a lot of work that falls way outside that helpline and that response from, and that's set over the themes and the work streams that I've mentioned in the report. So from keeping our food banks sustained, to working with local businesses to take up their offers of support, to a huge number of community projects and initiatives and promotion that we've done through all of our media channels, through our collective partnership resources. This has been a huge programme of activity. What we can be sure of now is that this is quite a well-established programme, and that we now need to focus on obviously what recovery looks like, what's the future look like for Operation Shield, and how we can obviously continue to support vulnerable and isolated people across BCP as we go forward. So I won't talk much about the voluntary and community sector elements of that. I think Karen gave a really good summary earlier. But as I noted in the report, the pandemic has, of course, delayed a number of pieces of work around the development of a community engagement strategy for BCP, community regeneration strategy, and probably now more critical than ever, the development of a community and voluntary sector strategy, which is the place where we would ask ourselves that question that Karen and I posed earlier around We've seen the strength of the voluntary and community sector in response to this crisis. What does that look like, and how do we take that forward as it's the legacy from this piece of work as we move into recovery and into our new normal? So I'll leave it there, other than to say thank you so much to everybody who's been involved, whether they're a volunteer or a member of staff or anyone from our partner agencies. It's been an absolute privilege to lead this as a piece of work. Thank you.
Thank you, Kelly. I just want to share something I got through on Monday afternoon, which I haven't shared with you yet, and it was an email from someone who is who I wouldn't expect to get an email from. He said, I had a visit today from a very pleasant young man who works for the council and is engaged in the vulnerable people support group. Wanted to check I had all the support I needed. Fortunately, I was able to introduce him to my carer and assure him I'm being very well looked after and not in need of anything. I want to express my thanks and appreciation for everything you're doing to make sure that we're okay. So he will have been somebody who hadn't responded to our calls because he didn't need us, and I'm really thrilled that that's actually happened and that somebody's come back. I will forward that to you, so because you'll recognise the name as well.
Thank you.
Karen, did you want to add anything before we move on to questions?
Very quickly, if I may, is just to say that we're very busy at the moment mobilising volunteers to help with the beach clean-up this weekend. It's out. We're going to get it out on social media. It's out this morning. I've signed up, so I'll be down there on Sunday with my gear on. I'm probably going to drag my husband and daughter with me as well, because we can moan about it, but actually let's go down there and do something about it. So we're very busy signing people up to come down and do a mass clear up this weekend. So yes, that was all. Thank you.
Thank you, Karen. And that isn't a one-off. That is something that we've now got the facilities to do on an ongoing basis. I'm hoping there'll be a press release going out about the plan. It got a lot of traction yesterday on Facebook Live. So if I go to questions, David Richardson, you had a request to speak.
Yeah, thank you. It was really just a comment to Kelly in particular. I've had a number of patients who we've directed through to your hotline because they're not shielding, but they had significant sort of problems with shopping. And the feedback from them has been amazing. It's been rapid, it's been efficient, you've turned things around really quickly. I just wanted to feed that back to you. So thank you very much for that. And what I'd really like to see is that sort of system continuing into the future, because it's a fantastic help for community services, primary care, as I'm sure everyone's aware. So thank you very much.
Thank you, David.
And I've missed a call during this from the lady I'm shopping for. She clearly needs me to go out shopping this afternoon, so I've got to deal with that when I get off. Councillor Dedman, you wanted to comment as well.
Yes, thank you, Leader. Yes, and can I also say it's a brilliant service, and I've had a lot of feedback about how happy people have been with it. But I've had one question, which was sent to me by another councillor, that it coincided with the gentleman concerned didn't get his food parcel, and the Prime Minister announced that shielding people were not going to have to shield, and he was panic-stricken. He phoned his councillor to say, oh dear, does this mean the end of everything? And no, it didn't, because the food parcel came, but it was just late. There was a confusion. But I want to make sure that when things change, people will be actually told, it will be communicated. Either the service is going to be done by somebody else or the service will be tailed off, because it was that sort of juxtaposition of, oh dear, my parcel hasn't come, and oh dear, the PM has given out a message that we're all right. So I just hope that we will still be communicating with people.
Shall I just respond to that? So just to be clear, shielding hasn't come to an end in any capacity, but it obviously will be reviewed this month. There has been an easing, I guess, in terms of the guidance, and people are who are in the shielding group are now able to go out once a day with some restrictions there to protect them. Food parcels from the government do still continue, but the national helpline are actually in the process of making contact with people who are in receipt of food parcels to make sure whether or not, just to review whether or not they still need them. And there's been some confusion around the receipt of a food parcel and that being linked to access to online shopping slots and priority slots for shopping. The two were originally just completely linked, and that now has changed, so people can opt out of the food parcels if they want to, and just move to the position in terms of the organising their own food and deliveries online. But in terms of the future of the food parcels, I know that's under review also nationally. So we're in, just to reassure, we are in much better contact now than we were a few weeks ago, directly with MHCLG and representatives from the Operation Shielding Directorate. And we're feeding back those concerns, Councillor Dedman, around making sure that people are adequately updated, both on a national level, and of course we'll be mindful of that locally.
Yes, that's great. Thanks a lot, Kelly.
That's great. Councillor Moore.
Yeah, thank you, Leader. Yeah, I will be brief, but I just wanted to say that this is an absolutely brilliant service. I am one of your volunteers. I've had 3 customers, or whatever you want to call them, and I've been doing shopping and picking up prescriptions and all the rest of it. And I think it's so good and it's so helpful to residents locally that I would be really pleased to carry on doing this in the future. And I think that, you know, we could take that forward. That would be really good. My only comment is about the food parcels. One of my residents is shielded. She gets these food parcels. She didn't want them. She tried to stop them and found it really hard to stop. And they kept arriving, and the person comes, dumps it in front of the front door, and then disappears, so she couldn't even tell him. I have been able to take it to the food bank, so nothing's been wasted or anything else. But it wasn't an easy thing to do to stop it. So I just wondered if you could sort of look at this, just in case there is a way, you know, that this could be improved. Thanks.
Thank you, Councillor Moore. That definitely was a problem. By far the easiest way to stop receiving the food parcels is to catch the delivery drivers. I've heard repetitively that they're incredibly quick, but catch the delivery drivers and refuse the parcel. But there is some guidance and some information on our website that specifically points people towards how to stop the receipt of the food parcel but continue, probably really importantly, the ability to secure their own shopping and deliveries through the shopping websites. So that has improved, but yes, it was difficult. The other thing, of course, just to mention on food parcels, the next thing that tends to come up in conversation is the quality of the food. That has been there's mixed feedback. But we've been able to provide some feedback directly to the MHCLG about some of the quality of some of the items in there.
Thank you for that.
Also, sorry, Councillor Moore and Councillor Slade and anyone else who's helping us through volunteering, thank you very much.
Well, I think I share Councillor Moore's sense that I have definitely made some friends for life, and this relationship is going to carry on. So hopefully that will start to build this kind of world. Finally, just before we move on, Karen, you wanted to add something about it being Volunteers Week.
Yes, I would be very remiss if I didn't, Vicky. I think I'd be killed. It's National Volunteers Week this week. Obviously, a lot more scaled down. Kelly and I had grand plans, didn't we, Kelly, for great celebrations. And earlier in this year, we were going to... and of course that's all had to be shelved, but it will be even more spectacular next year. So this year, thank you very much, Vicky, for your really lovely quote. We've got that on the front page of our website. We're using social media, we're posting all sorts of things, thanking volunteers. We're encouraging all our groups to do the same. So if anyone does it, it's all over Twitter and Facebook and Instagram. We're trying to get that out there and you know, to encourage everyone to say a big thank you in all sorts of brilliant and innovative ways. So I think that's so important. And I know that you're sending out information to the people that have volunteered as part of Operation Shield. And, you know, when you volunteer, I know when I volunteer, you don't do it for that, but actually it's just nice to get that recognition. It's just nice to get that thank you, isn't it? And I think that really matters. So we're doing all we can to get that out there this week.
Also,
I have to say, carry on, Callie.
Sorry, I was just going to say, I've just heard that it's Cheer for Volunteers tonight on the doorstep. So I'll obviously expect you all to be participating.
Yes, I'm going to say, Karen, I'm a little disappointed that you don't have the photograph of me that's up on Twitter with upside down in a Zorb ball when I'm volunteering at the youth club. You want to check out that picture. I literally look like, you know, when a turtle goes upside down, that's what I look like, because I couldn't turn myself around again. So, you know, volunteers do crazy things.
I will be retweeting that. And I'm going to get my daughter to film me outside my house in Poole tonight with my saucepan lid and my wooden spoon, and I'll be banging and cheering, I think, because it's.
Yeah, the question is, my neighbour said to me, is it cheer or is it cheers?
Well,
you know, should we be raising a glass instead? Cheers to the volunteers rather than a cheer for a volunteer, because it is plural. Well, I think we better move on that point, hadn't we? We either, it doesn't matter, cheer or cheers. I don't think it matters.
I'm quite happy to do either.
Or both. Okay, that brings us on a slightly more a more serious note. So brings us on to agenda. Oh, now actually, do we need to make any decisions on that? Do we have any dissent from noting the update? It doesn't sound like it to me. Okay, so failing that, agenda item 8, the application of Care Act easements for adult social care. Can I call on Jan Thurgood, who's going to represent the report on this for adult social care, if that's okay, Jan?
Thank you very much, Chairman. So I'm going to be very brief. You've got the report in front of you, and it's a report to note for the Health and Wellbeing Board. The Coronavirus Act enabled local authorities to think about whether they could fulfil all the duties required in the Care Act 2014 in relation to social care. There was a concern that staffing in councils for adult social care and also the availability of care in our local markets would be such that we would have to reprioritise both our activities in terms of assessment and review and support planning for service users, but also we might have to reprioritise the care we were giving across our community. What's been fortunate in our area is that we have not had to reprioritise care. We have been able to continue to do our assessments and review and support planning, and the capacity in the local care market, both in terms of domiciliary care and care home placements at the moment, is very good. However, in terms of what we have had to think about is the very act of introducing social distancing has meant that some of our services we cannot provide to people at the moment. The most striking of those is day services and day centre services, where we aren't able to bring people together for day centre activities and day service activities, and have found other ways to support people through that provision. We've also found that some services for people with hearing loss we're not able to deliver, and also some of our aids and adaptation services we haven't been able to deliver through the pandemic period. So in terms of the Act itself, they do constitute the lowest level of easement, level 2, so we formally wanted to report that to the board. However, we'll keep all of these under review, and as we go forward we will be looking at can we actually find other ways and not have these easements in place. I know that from talking to people who are carers and also hearing from people who are service users, that not having day centre services and day services available is causing an impact in terms of not being able to have the social care, contact that people normally have, and also respite care for carers. So we are looking at how can we expand the range of support that we can offer in a safe way, given still the risks of transmission of COVID-19. So we're continuing to do that review work. Happy to take any questions, Chairman.
Thank you for that. Do I have any questions while you're deciding if you want to speak? Can I ask a quick question? And that is, are our easements in line with similar easements in other parts of the Southwest?
They are. Interestingly, what people have, councils have taken different positions about whether legally the easements that relate only to social distancing, which are our easements only relate to social distancing, not to other capacity issues, are a level 2 easement, or they're not even a level 2 easement. So you've seen councils make different decisions on that. Our legal advice is that they are a level 2 easement, and therefore we've reported them. So everybody, in relation to the items in our level 2 easement, everyone has had to make the same adjustments because of social distancing.
That's helpful, thank you. Okay, I haven't got any requests to speak, so failing no requests to speak, is there any dissent from noting the 3 easements? Excuse my phone, it is on silent, but it still makes a funny noise. Okay, nobody's dissenting, so I'm going to take that as noted. Thank you very much for that, Jan. That brings us on to agenda item 9, Better Care Fund planning for 2019-20. Just a query, is that 2019-20 or 2021? I don't know, because we're in 2021. Perhaps Elaine Stratman's going to present the report. Can you just clarify, is that 1920 or 2021 looking backwards?
Sorry, Councillor Slade. Yes, it is for 1920s. You're absolutely right. It's looking backwards.
Okay, thank you. So I'll hand over to you to present the paper. Thank you.
Lovely, thank you. So this report provides an update on progress of the Better Care Fund plan up until February 2020, obviously before we went into the pandemic period. So it provides information on the strategic themes and operational schemes. Also illustrates in the report how we've adapted service delivery, and some of it does refer to obviously the pandemic period, particularly in relation to carers, how we've reorganised ourselves in regards to hospital discharge arrangements, and thirdly how we've supported providers through the pandemic period. The report also highlights our national targets, and unfortunately we're not meeting any of our national targets. It was a particularly difficult winter within hospital settings, and there was a lot of pressure within hospitals, quite often having to make some decisions when the hospitals are at Opal 3 and Opal 4 in regards to how we help them with patient flow. So therefore some increase in the numbers of adults going into care homes, which has obviously had an impact on our metrics. Also in regards to our delayed transfers of care, we reviewed and used our winter money in order to supply some extra domiciliary rapid response care in order to facilitate discharge. However, I just wanted to briefly reflect on that none of the metrics are being met, which is obviously a concern. One thing of particular point I wanted to raise around the report, and is at the second recommendation within the report, is around the delegation to the chair and vice chair of signing off of a Section 75 agreement in relation to the enhanced supply of out-of-hospital and admission avoidance care in response to COVID-19. So as you'll be aware, £1.3 billion came or is coming down from government in order to fund extra out-of-hospital care, and there was a process we need to go through to reclaim that monies. A decision was made between the Dorset Integrated Care System that the local authorities of Dorset and BCP would commission a number of initiatives to fund to support out-of-hospital care. So therefore, as a result of that, so we've been putting in things like a number of block beds in care homes, and also extra domiciliary care capacity, and a number of other initiatives, including extra equipment provision in order to manage hospital discharge and admission avoidance. So now what we've got to do is set up a Section 75 agreement, have that in place in order for us to reclaim money back from the government. The Section 75 agreement is currently being worked up, is not ready to be signed off yet, but like I just said, we wanted to delegate to the chair and vice chair that they sign off the Section 75 agreement outside of this board, if possible. Also, just an update, just to let you know, in regards to the Better Care Fund going forward. So the Better Care Fund team nationally are looking at reviewing the Better Care Fund and how the planning requirements are laid out. Hasn't always been easy in the past. Also to ensure we're more inclusive of our housing sector, and also they're looking at reviewing the metrics used in the Better Care Fund. So yes, that's about it from me. Thank you.
Thank you, Elaine. That's really helpful. I'm waiting for anyone to make a request to speak. I'll just ask a question. Obviously, this looks backwards, 2019-20. Since the pandemic, we've had quite a lot of change around funds being given to help support the discharge to assess model, which is now and the speeding up of discharge from hospital. I'm wondering, does that give us an opportunity to sort of draw a line in the sand and then be able to maintain these new standards to prevent the discharge transfer of care, the DTOC problems that we've had over the last couple of years?
There has been a lot of national and local interest in the discharge to assess model that has been put in place during the pandemic. Currently an evaluation is taking place to look at that locally, and I think the national team are also involved in informing that. We also wanted to understand what user experience was, so how people felt about going through this discharge to assess model and whether they had enough choice and control through this model. So, I mean, Louise mentioned earlier around working closely with partners, and she's certainly working with us, or Health Watch are working with us to look at evaluating how users think about the service delivery. So you're absolutely right, there is an opportunity to draw a line in the sand and look at new models of discharge to assess processes or something similar going forward.
Thanks, Elaine. So first I have Tim Goodson.
Yeah, thanks. Just replying to the section 75, really very happy to do that outside of this board, but I'd probably suggest we have a session to run through it, because I dread to think how complicated it all got during the period, because everything that was done was really somewhat out of the normal sort of routine. So if we can put a session together, run through it, I think that'd be helpful, and it probably does suit better outside of this meeting.
Thanks, Tim. Sally Sancroft.
Sorry, I'm trying to get my video on as well as unmuting. I just wanted to maybe acknowledge some of the references in the report in terms of during a very difficult national emergency, there's been some really good learning and great partnership working, which I think will really mean that we're escalating some of our transformation plans together in terms of the new models of care and new ways of working, which we've really been able to push forward with, and you've just given an example of that, Vicky, in terms of what can we learn from the discharge planning that enabled us to empty half the hospitals within 2 weeks. So, and there will be some learning, but there will be some implications for that in terms of how we engage with other sectors in Dorset in the market, and how we use our collective resources to enable that to happen. And I think the other element of that is how do we ensure that we've got that complete package of support for primary and community people in primary and community settings, so we're also preventing people unnecessarily going into hospital, as well as the focus on the discharge elements of that. And the work that we've been collectively doing around care homes, and we've really accelerated that wraparound support for care homes, which I know we'll come on to in another report, but also the way that we're using technology wound within that as well. I'm sure that there'll be some very positive considerations in terms of how we make sure we don't lose some of that new ways of working, and we continue on that path. I think for me it's also reinforced that we were going in the right direction. So all the things that we've been doing it's been acceleration of those, not anything radically different, but really moving forward on those achievements. So I think it's been great partnership working. Thank you.
Thanks, Sally, and I'm really glad to see the prioritisation given to carers in this. I think that's really important, unpaid carers as well. So that's I think really important to be there, and reflecting 1920 as the first year of BCP. So as a partner, actually it's quite difficult to bring all that together. Hopefully the 2021 will see a rapid escalation despite the COVID situation. Jan Thurgood, do you have a request to speak?
Thank you, Chairman. I completely endorse that it will be a real learning process about what's happened in the COVID-19 period and what we can really positively take forward, and completely endorse the comments about really hearing people's experience who've used services. I think that's absolutely critical. The thing I additionally wanted to say is that we've been working really closely with adult social care representatives of the sector, and that's been really important. And I think I'd like to say a big thank you to our adult social care provider sector leaders and all providers who've been working with the statutory sector, but also have been working in partnership with each other. And I think people have do collaborations, and I think that's been a really good new collaboration. And I'd like to really thank adult social care sector providers for their input. As we look forward, we are going to have to think about the shape of our adult social care sector market going forward, what we've learnt in the pandemic. And at the moment, I was talking around having really good capacity, for instance, in domiciliary care at the moment. Often one of the constraints we have in hospital discharge is the ability to access some of the care in home care that we'd want in our community. So we've got some really interesting learning about what's happened in this phase, but also how we can translate that to the future.
Thank you, Jan. I don't have any other requests to speak. So again, this is to note, obviously the other bit being the recommendation around this being taken offline between myself and the Vice Chair. So do I have any dissents from the recommendations in the report? If not, then we'll take that as read and move on to the next item on the agenda. Thank you, Elaine, for that. That's great. Agenda item 10, Coronavirus Care Home Support Plan, which is being presented by Jan Thurgood. But I note that Sally Sancroft and Sam Crow may be adding some support to this. So, Jan, can I pass back to you, please?
Thank you very much, Chairman. I'd just like to start by acknowledging that, as we heard earlier, COVID-19 has had an impact across our community, and it's also had very tragically an impact in some of our care homes. And I want to recognise the impact for people who've been affected by the death and loss of people in our care homes and loved ones. Our heart will all go out to everybody who's been affected by those losses, families, relatives, but also the care staff who work with people who have died. I'd also like to start by recognising the tremendous contribution and effort and professionalism of all our care home staff and leaders through this period, and to thank them for it. So in terms of the care home support plan, Government announced on the 14th of May a national care home support package, and also required all local councils, NHS and care providers to work together to produce local care home support plans. Those plans cover a wide range of areas, really designed to prevent the spread into and within care homes of COVID-19, and are focused on infection control measures. So they span looking at issues such as PPE, the accommodation available in a home and whether it's possible to effectively care and isolate for people who do have an infection. It's looking at how staff are used and using staff being used across home settings. It's looking at the clinical support given to care homes, and I know Sally Sancroft will comment more about that from primary and community care. And it's also looking at the testing available to residents and staff for COVID-19 in care homes. So there was a requirement to put together local support plans. We've done that very much in collaboration with our adult social care providers, and we have developed an initial draft plan which was submitted regionally to NHS England and local government on the 29th of May as required. It's not yet a finalised plan, so it's not yet available to the board or to be published. It will be finalised in the coming weeks, and it's also based on the contribution and feedback from all of our care homes. And at the moment, we have about 90% of our care homes have given individual responses to the questions asked, and we're following up that with the remainder 10%, because what's important is that every home has this package of support around the home. So I just wanted to highlight a couple of issues out of the care home support package, one of which is the provision of personal protective equipment known as PPE. And what's really encouraging at the moment is that we have all of our care homes reporting that they have sufficient PPE. We have just one home that would like the provision of additional PPE to that over recommended guidance, but other than that, all of our homes are reporting having sufficient PPE, which is a really, really good response, and is a mark of the collective work that's been done across the local resilience forum and the councils with the sector around really ensuring that our homes are able to access PPE and have resource to can apply to the council if they aren't able to get the PPE from their normal suppliers. So that's very encouraging. Second thing I just wanted to highlight is the government has made available an infection control fund, which is money which is coming through councils to be passported to the adult social care sector. For BCP Council, our share of that is just over £6 million. That funding is going, 75% of that is going to care homes for infection control measures related to staffing. And we're having a dialogue with the adult social care sector leads themselves around how we would use the 25%, which can be used at local discretion, and the view at the moment locally from the adult social care perspective and from the councils is that would go to support domiciliary care and supported living providers. So I will stop at that point and I think hand it over to Sam, who may want to comment on testing.
Thank you very much, Jan. Just trying to start my video. So some of you may be aware that there is a national target around testing in care homes. The target is for all care homes to be able to register and receive test kits by the 6th of June. And that's really important from a public health perspective because we're beginning to learn more and more about the importance of asymptomatic transmission and the role that that's played in some of the outbreaks that the homes were experiencing, particularly at the peak of the local outbreak. I'm really pleased to say that most care homes in BCP Council through the government portal to access testing kits. I believe most homes have a date now for those test kits to be sent to the home. There are a handful that haven't registered, and we're following up locally with the reasons why they so far haven't registered, just to try to understand the reasons why. But that's a huge change from the situation that we were facing a couple of weeks ago in terms of being able to bring forward that testing capacity and really focus it around the homes. So I don't intend to say too much more on that point, Jan, but happy to take any questions.
Thank you. And I just wondered whether Sally comment.
Thank you. Yes, I'll just highlight a couple of pull out a couple of areas. I think one to start with to say that I think in terms of the NHS, both Dorset Healthcare and particularly primary care networks as well, a really strong recognition of the need to support care homes in whilst recognising that that's a very vulnerable part of our population. And our key strategy has been, how do we identify those people that are most vulnerable, and how do we wrap care and support around those individuals? And of course, a number of those are clustered through care homes. So one of the things that we've been particularly doing is really accelerating our work programme around enhancing that care and support in care homes, and doing that in a very joined up, coordinated way between the different sectors of the NHS, but obviously clearly with the local authority as well. I think it's fair to say that the directed nature of NHS England's advice that came out was very, very prescriptive, which did cause some challenges. So, for example, the way that it was prescribed that we needed to approach the infection control training with care homes was very prescriptive, and similarly the requirement to have a clinical lead. Notwithstanding all of that, I think we've really seen a rallying around and a really quick acceleration of the support. So we're now going to be in a position as of this week to provide the LRF chair, which is one of the requirements, with the names of all the clinical leads for each care home. That clinical lead function hasn't been very well defined nationally, but we do have a multidisciplinary team for every care home in which those functions have been and will be delivered. But in addition to that, we'll also have a named clinical lead, and that very much fits alongside the work that primary care networks have been doing to align a primary care network to each care home, so there aren't several practices linking into a care home. There is one, and that will be linked to one primary care network. Because as you can imagine, in the urban areas of BCP, we have people residing in care homes that could be registered with a number of practices. So we've now managed to, apart from 2 care homes, which we've got a process that we're going through, managed to achieve that alignment, and that's brought that forward by several months. So we had a planning assumption around that for September, October time, linked with the primary care network direct enhanced service. So there's been some really positive achievements in both the infection control training and the clinical lead and wraparound support by the MDT. But I can say it's not been without its challenges. Thank you.
Thank you, Sally. There has been a question, just for the public benefit, about the tests being rather unpleasant to go through, and the impact that we expect that might have on care homes doing regular testing of residents. Just wondering if you could just make a very brief comment on that, because yeah, it does look pretty invasive, and if people are already very vulnerable, I don't suppose it's something they're going to want to do twice a week or whenever it's going to be.
Thank you, Chair. So I've made a couple of comments in the sidebar because it is a very valid point, and it's why we can't do testing in homes without supporting the homes adequately to understand their own particular context. I'm sure that there will be residents in which it would be very, very difficult and not desirable potentially to carry out a test, and we'll keep this area under review. The other point I'd make is that this ongoing role of testing locally and where we focus it will be a key feature in our local outbreak management plan, and it's really important that we're not testing unnecessarily, but we're directing it to where we feel that the need is greatest and responding to information that we have that might suggest that we need to focus on particular homes.
Thank you, Sam. Okay, so the recommendations around this is that we review the implementation, identify any extra actions, and consider if we want an additional report. Jan, was there a proposal to bring forward a further report for the next meeting? Is that the suggestion that we're being asked to consider?
Chairman, I think it would be, particularly as we haven't got to a point of a finalised plan, so the board may wish to see the finalised plan when it is available.
Okay, I think that sounds like a good idea. Councillor Dedman.
Yes, thank you, Leader. It's Sam, I just wonder how long the tests are going to take to get back to the care homes. What timescale will there be?
Thank you, Councillor Dedman. I believe that that probably has been quite variable. I wouldn't want to say on this call now exactly what the turnaround time is, but it's something that we are monitoring through the local task and finish group. I believe that the turnaround times are improving.
Thank you.
That was very diplomatic, wasn't it? Obviously didn't see the news last night about people who've not had We've not had anything through for 2 weeks. There we go. Probably not in our area. Councillor Moore.
Yeah, thank you, Leader. I've just got it's not so much a question, more of a suggestion. I was just listening to this, and it's really, really good news about PPE, that our care homes have sufficient. And obviously I've got 2 care homes in my ward in Camberton Heath, and obviously they do employ lots of staff locally. So I'm glad that they are actually well provided for. But because I feel reassured hearing this, I wondered if it was possible for either yourself as leader or possibly Leslie Dedman as portfolio holder to put out an email to reassure all councillors that locally things are okay. I just wondered if that would be a good idea. Thank you.
Very good idea. I think we could probably put something out. Jan, I wonder, can I leave that with you? Would that be all right?
Yes, thank you, Chairman. And it might just be worth noting that our scrutiny board for the BCP Council did have a subgroup looking at PPE, which reported back to the last scrutiny board. And I think from their inquiries felt again that the supply of PPE to the adult social care sector was enabling the sector to have sufficient PPE at this time.
Okay, thank you. So do we have any dissent from the recommendations in the paper? No, I'm conscious that we're over time. We're beginning to lose a couple of board members, so we need to move swiftly on to the next item. Thank you for that presentation. It's great. The agenda item 11 is SEND LGA peer review. So can I call on Julian Radcliffe and Sally Soundcraft to introduce this item, if you could?
So good afternoon. Thank you, Chair. Sally, if you're happy for me to start, perhaps I can talk to some of the detail in the presentation and hand over, if that's okay, Sally.
Thank you, Julian.
So this presentation feedback possibly falls between initial feedback, which wasn't provided quite soon after the review, and a more detailed update report, which I'm sure will be useful in the future. As a starting point, to be clear to everyone in the board, this was a challenge that we invited as a local area and as a partnership, because we're very clear that there are significant improvements required across the local area and all in many aspects of our SEND arrangements for children and young people. In terms of review itself, it was a 4-day review that was held at the end of January, and it was a really comprehensive and thorough review in every respect, and there was much learning to be achieved out of it. It feels like quite a long time ago in terms of the end of January, and in that so much has happened since then, and it really has in every respect. It's certainly in relation to our vulnerable children, the impact that COVID-19 has had on them, particularly those with additional and special needs. So working briefly through the presentation, there's details there of the peer review team, the process that we went through. It was a really helpful team, really broad experience, and a national set of experience as well, which we value greatly. The process, because it hasn't been talked through, is one not dissimilar to an inspection actually, although that's not its intent. Is one based on self-evaluation, significant documentary review, and analysis of the data that we can make available. Review and analysis of EHCPs, those are education health care plans, which are the statutory documents which are used to understand children's needs and details of what is required to provide for them, but also significant engagement interviews with partners, parents, carers, children, young people, anyone involved in arrangements in relation to SEND. I'm just going through my slides. I'm finding it quite hard at the moment. In terms of the areas that were considered, again, actually the areas that we agreed were very much in line with what a local area inspection would consider. They consider leadership and government, capacity and resources, identification of special needs, the assessment of needs, and actually how in the round our local area, including everyone within it, can have more impact in making sure that outcomes for children and young people improve. Before I move on to, just move my slides down, apologies. Before I move on to recommendations, I suppose I'd want to make sure that given we represent such a diverse range of professional contexts, When we are talking about SEND, we're talking about it in the round, it's important to understand this isn't just the local authority, the council as BCP. It's a local authority, it's health and related providers, our schools, our colleges, it's our early years settings. It very much is a 0 to 25 years agenda. So it is linked to early years, school age, post-16, post-19. And because many of the outcomes for children and people with SEND, complex or otherwise, are often not as good as they should be, and because of the some of the outcomes linked to high levels of exclusion, linked to offending, interest in this area and response comes into youth offending services and the police as well, so there's interest there. But also when we undertake these reviews, we're not just talking about children with really complex needs, we're talking about children with SEND across the continuum of need. So it does include understanding how we respond to those children with, by comparison, lower levels of special need as well, alongside those who need a statutory and specialist response. On page 64 of the bundle that's shared with you, there's a series of recommendations. There are 12 which were dropped straight out of the report provided by the LGA. And if you theme them across, they theme as follows. We took some challenge in relation to our processes in how we prepare, undertake needs assessments to inform education and healthcare plans, how the plans are prepared and written, and subsequently how they're reviewed. And there was a strong steer that there was insufficient compliance in that respect. So HCPs were a real concern as identified by the local government, by the LGA. In addition, we received some challenge in relation to our effectiveness in communicating with partners and stakeholders, but in particular parents, carers and children and young people, and our engagement, and not just communication, our engagement with those key individuals and stakeholders. Another theme was in relation to co-production, that our ability to develop solutions and introduce new developments meaningfully as opposed to tokenistically with parents, carers again in particular, but with some of our partners. We received some challenge in relation to our schools in terms of the extent to which they are sufficiently inclusive and are sufficiently compliant with the requirements of the statutory components of the SEND reforms from 2015. And we also received some challenge in relation to our joint commissioning arrangements. So in terms of how we've responded to that in the first instance, I'll signpost you to slide 65, which is which represents the engine room of all the work that's happening across our local area in the area of SEND. We have a SEND Development Transformation Board, which I chair in my role as Service Director. It's a large board, and it is very well represented in terms of having the right people sitting around the right table asking the right questions, and I hope delivering the right outcomes. There's a list of representatives within there, which probably understates how many people contribute to the board. But all the recommendations that sit within the LGA review, as they've been shared with you, and all previous and known concerns in relation to our SEND arrangements are currently sat within a SEND development plan. That plan is owned by the Transformation Board and currently operates 6 work streams which are quite well developed and I would say sophisticated. So the work streams that the board are obsessing over at the moment include joint commissioning, co-production, school place efficiency, specifically in relation to complex SEND, the place of quality assurance, preparing for adulthood and inclusion, in particular inclusion in schools. And those are the areas which the board has chosen to prioritise at the highest level at the moment. However, I can offer assurance that all the issues within the LGA review have been picked up within their work plans as well. Apologies, I'm just working through my presentation. In terms of progress, and I wouldn't take this for granted, I just made a reference to a few things which I think are particularly relevant because they cut to the chase in many respects. One of the most interesting and powerful things that we've achieved is a really strong sense of local area partnership. The commitment to delivering on the changes that we know are required across the local area is very impressive, and I thank partners and colleagues in relation to that. There's been significant work in relation to the area of inclusion, in particular in how we have managed to successfully engage with our schools, and I believe establish a more inclusive culture, which I'm confident will lead to a significant reduction in how children being excluded from schools in particular and being socially isolated. But perhaps more importantly, making sure that those children with complex SEND in our schools, whether they're mainstream schools or special schools, have the best experience they can and a wholly inclusive one. And we're really working hard to make sure that schools have the best workforce development opportunities they can, and with this, that children get the best arrangement at school that they can. We've undertaken significant work in relation to the process in relation to education, health and care plans. However, as I made reference to earlier, we're working to the reasonable endeavours arrangements that we've allowed to, and that has caused delays. So we are not as far progressed in that as we would like, and it is creating some tension within the system, and we have a lot of parents who remain very concerned about this process. I think we've made significant progress in how we prepare children and young people for adulthood, which is referred to as PFA, to make sure as children transition from pre-16 to post-16 arrangements, we have a much better understanding as to how we can provide for them, in particular those with the most complex needs, and where we can try and keep them in local arrangements, educational and otherwise. In addition, I know I'm slightly short on time, Chair, so I will be brief. We've made significant inroads in extending the capacity of our schools to provide for children with the most complex needs in-house, by which I mean within BCP, as opposed to having to rely on the higher cost independent non-maintained schools and the challenges that brings with it. Joint commissioning is moving with some pace as well. We've established multi-agency resource panels to make sure there's tripartite discussions and arrangements about how we fund services and arrangements, in particular high cost placements for children and young people involving education, health and social care. I think we've made significant inroads in terms of co-production, in terms of our ability to engage with parents and carers of children with SEND, and also in terms of our participation arrangements with children and young people with SEND. And I think we should be very pleased with that. Possibly, Chair, in light of time, I will probably stop there. There is more detail to be shared at a later stage, I suspect. And I'm happy to take any questions in relation to the issues I've raised.
Sally, did you want to add anything to this?
Yes, please, briefly, as I'm aware of Chair. I just want to highlight our absolute commitment to continue to work with the Council in this area. We really feel it's an important area to make faster progress than we historically have. In response to that, we've recognised that we need to grow our capacity within the CCG to enable us to move better at pace. So we've out to advert for another designated clinical officer to support our existing clinical officer, Steve Clark. That will really help with some of these activities that Julian's described, including how we respond to the feedback from parents and young people, but also how we develop greater assurance and timeliness of health's contribution to the care plans, as one example. We're really committed to continue to make the obvious links around the learning from care, education, treatment reviews, the development work that we want to do, and are starting around the autism strategy. And also how we review the effectiveness of our behaviour pathway and people's experience of accessing that pathway and ongoing access to assessment. So we've got a lot of activities that we're engaged with the Council. Some of those are summarised in the slides, but actually want to reiterate our commitment to work with the Council in this area. Happy to take questions at your indication, Vicky.
Thank you for that, Sally. Councillor Moore, can I bring you in briefly?
Yeah, thank you, Leader. Yeah, I didn't want to ask a question. I just wanted to make a statement more than anything else. I'd just like to thank the officers for all the hard work that they're actually putting into the improving special educational needs. And obviously, as a ward councillor, and in my predecessor days of being a councillor, I knew that all was not well in the SEN world because basically parents had told me as much. And since becoming a portfolio holder, I just wanted to say that I am you know, one of my biggest priorities, the highest priority, is to improve services for children and young people with special needs. And I know that a significant amount of work is actually going into to actually achieve this. And I hope that all the work that's going on will come back to this Health and Wellbeing Board, and also to go back to Children's Overview and Scrutiny Committee, which I hope is going to start shortly, so that we can actually do what we can to support the needs of the young people. Thank you.
Thank you for that, Councillor Moore. Do we have any other requests to speak on this one? I know that we have the SEND report that comes back to us on a regular basis, so perhaps we need to look at the more detail about what we're doing rather than the review itself at the next opportunity. So if I haven't got anybody else wishing to speak, can I thank you for that report, and can you pass on our thanks to the LGA peer review team for the work that they did in coming down to support this? It's really important to us all. I think we're just noting the latest position. I don't think there's a requirement for a vote on this unless anyone has anything that they want to challenge on that. If not, that will take us to agenda item 12, which is the forward plan. Just any comments really on the forward plan? The meeting previously scheduled for the 17th of June is being cancelled and rescheduled. We are looking for a date in view of the fact that we need to look at the local outbreaks. We are looking at trying to have some sort of meeting in a fairly short space of time. It may well just be a single item that we need to deal with rather than a full Health and Wellbeing Board. We also need to consider our development session on the local plan and housing delivery, because the local plan is on a timetable. We need to make sure that we deal with that at an appropriate time. If Kate is still with us, whether she needs to raise anything around timings on that.
Hi. Yes, Kate Ryan's still here. I'm waiting for a reply back from planning colleagues to just check that that's what the most appropriate and useful time is for the board to contribute on the local plan side. I think you're muted.
You're on mute.
Yeah.
We can't hear you.
We've still lost your sound, Vicky.
I'm back. Am I back? Can you hear me now?
Yes, that's better.
Oh, okay, sorry. Something went into not responding, so I'm back in nick of time. Tim, you're relieved. The only other thing that we have if everyone is content with the forward plan, if everyone's happy, we'll note that for now, which just leaves us an item of any other business. I need to call on Sam Crow, who's got an item relating to the local outbreak management plans, which we need to bring forward as an urgent item. There are new national requirements. So I realise we're over time. So Sam, can you just briefly introduce this and let everybody know what our proposal is on this one?
Thank you very much, Chair. I will be very brief. So as the leader has just outlined, this is a very rapidly developing requirement of all councils, and we must develop a local outbreak management plan to be in place by the end of June. And the plans really focus on the statutory responsibility of the Directors of Public Health working in councils to protect the local population from COVID, working closely with Public Health England, and also our sort of collaborative work with the Local Resilience Forum. There are 7 themes around which the plans will be structured, probably no surprises really. They will focus on settings most at risk of future outbreaks, so care homes and schools in particular. Any other areas that we consider locally to be high risk, that could be particular workplaces. It will set out how we work alongside the information coming in through the new NHS test and trace service and the National Biosecurity Centre, and how we use that information and intelligence to undertake our local surveillance for the virus and use that data to direct our response efforts if there are local outbreaks. The final theme is around governance, and that's what I just wanted to talk to the board about today. So I just wanted a brief discussion to sort of set out early thinking about how the governance around these plans might work. The first point is that most of the tactical and operational delivery of the plan would be carried out via an officer-led health protection board. We have an existing health protection network which works across both council areas. Just Dorset CCG colleagues are represented on that board, as are environmental health officers and others. We would probably need to add some officers into that board to cover links between children's services and adult services. The most relevant bit is that the guidance lays out the requirement for local areas to have a public engagement board in place led by elected members. So the proposal locally, and this is what I welcome views on today, is to use our health and wellbeing boards in each area to carry out this function. So two quick issues to consider. The first is to sign off the plans. As they're going to be required by the end of June, we would probably require an extraordinary virtual meeting in early July just to sign off the plans that are developed. And also some discussion about how the board could function and respond quickly as a public engagement board, working very, very closely as we carry out that plan. And my early thinking is that might require a subgroup of the board to be developed that could be called on quite quickly. So if there's any kind of upturn in either cases in our community or significant outbreaks, we can stand that group up very quickly to agree how we're going to communicate with our public and discuss any measures or powers that we might need to get in place to control COVID. That's it for me. Thank you.
From a governance perspective, do we know, I'm wondering whether we need to call on our governance people here about how many people and the makeup of that, bearing in mind we've got to have this member-led route, whether it needs to be evenly balanced in the same way as our balance between local authority and other partners. It is a member-led grouping. So what's the proposal around who that needs to be? We need to take that offline, because obviously we need the approval of, do we need the approval of the board is really the question I'm saying, bearing in mind the government have dictated that it's a member-led group.
So I think we'll probably need to take that offline and work up a proposal based on the learning that's coming forward from the 11 areas that are developing as beacons. I think that today we're just looking for broad support from the board for the direction of travel, and to sort of share with the board once we've got further detail on that proposal.
Okay, does anyone have any comments on that? If not, are they content that that is a good direction of travel to start with? Yeah, obviously we've got to move quite quickly on this. We are required to produce this by the end of the month, so we are under quite a lot of pressure. So if I don't hear any dissent, then if we leave Sam to take that away and bring that back initially to me and the Vice Chair to take it down and get a paper written up.
Thank you very much.
Okay, everyone seems content with that. So that brings us to the end of the meeting. I'd like to thank everyone for their attention. Apologies for overrunning. Just say thank you all so much for the amazing work you're all doing in the sector, and I hope you all stay safe and well. Take care.